We begin with new information on the coronavirus outbreak. The World Health Organization upgrading the global risk today to very high. That is the agency's highest level of alert. The Centers for Disease Control warns that no country should expect to be spared, and all must be ready to combat an outbreak. The market also took another big hit, leaving Wall Street with its worst week since the 2008 financial crisis.
There are more than 83,000 cases in at least 50 countries. South Korea, Italy, and Iran have the most cases outside of China. 2,800 people have died worldwide from this virus. In the U.S., 62 people have tested positive, most of them evacuated from Asia.
And there's a big development tonight in our area in the fight against coronavirus.
New Jersey and Connecticut received federal approval to administer a test, eliminating the need to send samples out of state. CBS 2's Aundrea Cline-Thomas in studio now with more. Aundrea?
Well, this means that patients will know if they have the virus much sooner. Faster results would lower the amount of people placed in isolation and help doctors develop the best treatment.
24 hours. That's how long Connecticut officials say it will now take to determine if someone has a coronavirus.
We recently got a little bit of good news that we're now allowed to test, at least at our laboratory in Rocky Hill under the our own public health center. That's positive, but we need more support from the federal government.
The feds are allowing the health departments in both Connecticut and New Jersey to administer their own tests instead of having to send samples to the CDC and waiting days or sometimes weeks for results.
It's good that the Department of Health in New Jersey can do that. I want to make sure that we can maximize the universe of who can do the test.
To Senator Bob Menendez, that means going a step further by allowing other medical institutions like Hackensack Meridian Health to also be able to test patients. Menendez toured the lab where 2 coronavirus tests have been created with results made available in 2 hours. But they still need live samples of the virus from the CDC to see if it actually works.
It would give us direction in terms of isolation and ongoing treatment for that individual in a world where we have relatively scarce resources.
With immediate results, doctors can know if isolation is needed. It removes the current uncertainty and helps address growing fears.
And this is what we got to do to prepare for an eventuality which I hope does not come to our shores, but we're ready.
So far, there have not been any confirmed coronavirus cases in the tri-state area, but medical professionals expect that to change, and they're asking the federal government for a more aggressive approach to make sure they're prepared.
And testing has not been approved in New York. Both the local and state health departments say the elements they received from the CDC to create the test had problems, but they're working with the agency to get authorization. Maurice, Christine?